Hi there, I'm Jonny, physiotherapist here at Nightingale Health Services. I'm here today to give you a few quick tips about sleep position. Obviously there's three general positions our patients come in with, sleeping on the side, sleeping on the back, sleeping on the front. So if we take a look at each of these individually, generally we recommend that patients sleep on their side. Things to consider in this position is neck position. We want to try and keep the spine as neutral as possible. So the pillow needs to try and allow the spine to stay as fairly straight and level as possible. So for me, this is a little bit low, my ear's coming down too far. So I would suggest for myself with these soft pillows that I have two, and that will keep my spine at the back in a much more neutral position. The other thing we need to consider in this position as well, if people have low back pain, is possibly to just pop a pillow in between the knees. Okay, second sleep position would be sleeping on our back. Things to consider in this position is that the pillow for your head needs to be that little bit lower. This is just so your head doesn't curve too far forwards if your pillow's too high. The other thing we need to consider is that the back doesn't arch too much. If my legs are flat, my back arches, so I'd suggest to my patients to either fold a pillow or have a couple of pillows just underneath the knees whilst they sleep. Third sleep position, sleeping on your front. This is the position we recommend the least, mainly because when you're turning your head, you're shortening the muscles in the neck, so you're not keeping the spine in neutral. But if you do have to sleep in this position, low pillow will always be the best to keep your spine in as close to neutral position as possible, and also another pillow for underneath your stomach so that your back doesn't arch too much. So just to quickly demonstrate, over the pillow so it reduces the curve on my spine, and then turning the head to the side with the pillow on a slight angle so you can breathe. That concludes our sleep tips for today. Generally, if you have any aches and pains, we recommend you seek further advice because a lot of these positions can be slightly tweaked and altered depending on the exact pain that you have. But for more details, contact us here at Nightingale and we'll get back to you as soon as possible. Thank you.